Mrs. Smith. My name is Renee. I'm your CNA for today, and we're going to give you a foot bath, okay?
Okay.
All right, before I start, I have my patient sitting on the bed because we do not have any chairs that are low enough for her feet to touch the ground. So since you're on your bed, I'm going to just make sure that your bed locks are locked. I'm going to provide a privacy curtain. Make sure that your bed is at a good level for working. All right, I'm going to gather your supplies, okay? So I gathered your supplies and bring over our table. All right. So I'm going to bring this on over so you can see what I'm doing. All right. I'm going to grab my don my gloves. Grab a new one.
The one.
Oh, I don't want to use that one no more. Oh, what the heck? We'll grab another one. I'll make sure to throw this in the trash when we're done.
Yeah.
Okay. Well, before we start, I'm going to have you just check to make sure that the water's okay. Good.
Yeah.
Is that okay?
Yeah.
Okay. Here, you can just tap that on there. This is clean. Okay. So we're going to put this on the ground. This is going to be your barrier. So
Yeah.
we'll put this down. There you go. All right.
Then.
Oh, hold on. Put that down. You're good. I'll do that for you. Okay, I'm going to bring this down. I have 2 washcloths and a drying towel.
Yeah.
And your soap and lotion. Okay, I'm going to put my knee down on the barrier. So we're going to wash this is your right foot.
Yeah.
So I'm going to pull up your pants. Take your sock off.
Yeah.
I'm going to bring this over. We're going to stick that in. Now normally we would let this soak for 5 to 20 minutes, but for today's purposes, we are just going to continue on with the washing.
Yeah.
So you can leave that in there.
Yeah.
Okay, and bring this down. You know what? Okay. So now we're going to apply some soap.
Okay.
We're going to wash your foot. I'm going to bring this up. Up to the tops, the bottoms, the heels.
Yeah.
Okay. Make sure I get in between your toes.
Yeah. Get between those pinkies.
Mm-hmm. Okay. I'm going to bring this back down. I'm going to throw this in the hamper. I'm going to use your wash rag to kind of rinse. So again, I'll bring it up. We'll wipe again. And again, making sure that we rinse in between the toes. Does that tickle?
Yeah.
Okay, you can leave that there. Put that in the laundromat. All right, so you're going to bring your foot up and we're going to dry. I'm going to actually move this over to the side.
Yeah.
So we're going to dry your foot. Make sure again that we get really good in between the toes.
Yeah, because they could dry up and itch.
Mm-hmm. You can harbor that bacteria.
Yeah.
If they're moist. All right, does your foot feel dry?
Yeah.
Okay, you can set that down. Place that in the hamper. Now I'm going to put some lotion on your foot, okay?
Okay.
Oh, this is brand new.
Yeah.
Okay. Put on some lotion.
Yeah.
I will warm it up with my hands.
Yeah.
Okay, we'll apply at the top, the sides, and the bottom. We will not get in between the toes.
Okay.
Make sure, that smells really good. Okay. There is that. And would you just like your sock back on or your shoes?
My sock.
Your sock, okay. So we'll put your sock back on. All right. 4. Okay. I will take this.
And I could put my...
Yeah. This will go in the hamper. This will go in the hamper.
Yeah.
We will roll this down. I'm gonna throw this away before I take off my gloves.
Yeah.
So I will pinch.
And you got some gloves over there too.
Yeah. Gather. And like so. Throw that in the trash. Alright, Mrs. Smith, is there anything else I can do for you?
No.
Okay. Here is your call light. Make sure that the bed is still lowered. Or your wheels are unlocked if you're in a wheelchair. If you need anything, just give us a call, okay?
Okay.
I will again make sure that the bed locks are locked. Locking bed locks. I will bring this back up here so you can see what I am doing. Okay. Bed locks are locked. I will open up the privacy curtain. All right, Mrs. Smith, you have a good day.
Okay.
I will perform hand hygiene.
Yeah.
So this is where I'm going to need you again, Miss Felicia Tone.
Okay.
So now I will clean up my work area. So I will make sure that my hand sanitizer is in.
Wow.
I will reapply gloves.
I'd settle for Branson at 41.
Okay, nice, so Jan.
It only feels like minus 18. I don't even know if it's
I ripped that one.
Okay.
Wait, he must have picked this up from you.
Okay. So now we will go clean up our equipment. So I'm going to hand this to you. I will take my basin and my stuff. Okay, ready?
Yeah.
Go to the bathroom. Okay.
45.
So I just want you to stay right there, okay? I'm going to put this in its designated spot.
Okay.
Dump this in the toilet.
Yeah.
I will then with a paper towel turn on my faucet.
I'm moving a
Oh, stay right
little.
there, please.
I know I was just moving a little closer so I could get the
And we'll swish it.
good view.
Dump. Okay. And then I will use the rest of my paper towels to dry the basin.
Yeah.
And I will put this in its designated spot. And I will take off my gloves.
And throw them in the garbage.
And then I will perform hand hygiene.
No. Sure. Hi, Cassie.
Okay.
Hit.
Yep.